2025, there was a fair amount of volatility in the healthcare sector over concerns about regulatory risks from the United States. So tell us a little bit more about what your view on that is.
Part of investing in healthcare is there's always policy risk across the spectrum of healthcare. The biggest payer of healthcare for people is government, whether that's US or especially developed markets and even in some emerging markets. So with 2025, there were a number of different issues that grabbed headlines. One was the appointment of RFK Jr. There were concerns initially when there were cuts with DOGE. Is that going to be disruptive to staff at the FDA? The answer for the fears of those ended up being no. The FDA has managed to go through that workload, and they maintain to be science-focused, data-driven. What has ended up being more important is drug pricing. It's important for companies to want to maintain higher prices. It's also important to patients wanting lower prices. So what the administration did was try to impose tariffs and threaten companies with tariffs unless they invested more into the US in terms of R&D and manufacturing footprint. What we've seen since late last year and into this year is that all the major companies that were the target of the administration have signed deals with the administration, exempting them from tariffs. They've committed to various investments into the US. The US is actually trying to help these companies apply pressure to European governments to pay more. We've started to see some early signs of that with UK enabling some higher prices and covering some more drugs at higher prices. That's a good start. Companies are saying that there's been a thawing in Europe and they aim for that to continue.
Bad for us as consumers, but better for the profitability of the companies, then it sounds like. So I want to dig into that aspect a little bit more. Is more innovation coming to the United States, or are you seeing levels of innovation start to rise in other parts of the world?
In the biopharma industry, the US has been a bastion of innovation for a long time, led by hubs in the Boston metro area and the San Francisco metro area. That has largely remained unrivaled until very recently. Starting around a decade ago, China really reformed their regulatory structure. China also decided that it was a strategic government initiative to drive innovation in medicine. And what we've seen now is this explosion of innovation out of China. Companies are addressing the shifting of innovation to China in various ways. So some are bolstering their own innovation hubs in China to have access to leading scientists in that country. They don't really care if they're licensing it in from a small Boston-based biotech company or a small Shanghai-based biotech company.